Good morning and welcome to the ICCT's ongoing webinar series. Today we will be featuring recent findings of our Global Snapshot project. I'm Sarah Keller, a member of the communications team at ICCT, and I'll be moderating today's webinar. In a moment, I'll turn this over to our presenters, Raymond Harris, our Clean Air Program Lead, and Sarah Chambliss, a researcher on the Clean Air Program.
All right, thank you very much, Sarah, and welcome everyone. It's a real pleasure to have you all with us. As Sarah said, I'm Raymond Harris. I manage our Clean Air Program here at the ICCT, and we're pleased today to have you with us as we walk through some really interesting work we've been doing in the Clean Air Program to try to tackle this really big picture question around what exactly are the health impacts of the transportation sector at the global scale and also at the national scale, and how can we come up with good estimates of how this impact is changing over time using the best available tools, data, and information to inform both the strategy here at the ICCT and also our partners work looking at a global scale and really trying to tackle the problem of the health impacts of transportation. So what we're going to do today is really focus on a couple of things. I'm going to first just provide about a 10-minute kind of background and context for you all so you get just a better sense of where this is all coming from and how it fits in the work of the ICCT. And then my colleague Sarah Chambliss will walk us through some really recently published work that we've done, published in the journal Environmental Research Letters, that is our first attempt to try to get this picture, which is why we're calling it a global snapshot, but really to capture this picture of what the health impacts are. So for those of you who don't know about the ICT, let me just spend 30 seconds. We are a research organization with offices in the United States, Europe, and in China. And we have an international council of international transportation experts and policymakers working in the top vehicle markets around the world. And we focus on the top vehicle markets because they're the ones that really define what the new vehicles look like that are entering the global fleet. And these are what shape the future emissions and the future impacts of those emissions on their populations and on the global population as a whole. We have strong links with other research organizations, and particularly the Health Effects Institute, whose president is the chair of our board of directors, Dan Greenbaum. We get our funding primarily from philanthropic organizations, including the Hewlett Foundation, the Energy Foundation, and other government sources as well, including sources in Europe and elsewhere. So let me just provide, for those of you who don't have all the time today to spend with us, just what our key messages are from this presentation today. First of all, if it's not already clear, there are really few estimates that exist of what the global health burden is of the transportation fleet. And this has posed a problem to us here at the ICT as we consider how it is that we track and evaluate our success as an organization in achieving our mission, and also how that information might inform how effective the strategies are that we are recommending to other countries in the course of our work. Now, most recently, the ICT has actually demonstrated that it's possible to make such estimates. However, given the state of the data that's available that's necessary to make such estimates and also the tools that are required, we found that while such estimates are possible, there are still some limits to those, and it's important to take those into account, and we'll discuss what some of those limits are. We think that given this, that there's a fairly clear research agenda that the research community can and should pursue to carry this work forward in cooperation with the ICCT. That includes emissions modeling at a global scale that's looking at sector-specific emissions. That includes air quality measurement and source apportionment work that's necessary to validate the emissions inventories, as well as the modeling that comes out of air quality models. And it includes air quality modeling at a global scale that can achieve fairly high resolution at an urban scale, where the exposures to vehicle emissions dominate. And we think that with this kind of research agenda, we see quite valuable interdisciplinary exercise that can provide the kind of policy relevant research we at the ICT need in order to support those government institutions that we are working with on a day-to-day basis to support their efforts to improve air quality and public health. So here at the ICT, it's our mission to improve the environmental performance and the energy efficiency of on-road vehicles, marine vessels, and air travel, so airplanes. And that's to really focus on public health and climate change. And we like to keep those two impacts tightly linked because benefits in one area can sometimes lead to disbenefits in others. So we want to identify policies that support both. Now, we've created this global snapshot project, and the word snapshot is there because, as I mentioned, we're trying to take a picture here of what the health impacts are of the global transportation sector. We want to know what is the public health impact of road, marine, and air vessels, these forms of transportation. And road to us includes off-road, such as agricultural equipment and construction equipment, motorcycles, etc. And we want to know, furthermore, how it is that, or really how much the public health benefits from the improvements in the environmental performance of these modes. So most recently, and really I would say in the last 4 years, there have been a couple of key opportunities that have suggested to us that it's really possible to answer these questions. Some of you may be aware of the ongoing assessment that has been organized by the World Health Organization in partnership with others, and most recently with the Institute for Health Metrics and Evaluation, to update the global burden of disease assessment. And that, in the most recent assessment, provided some really new and interesting information, including really advanced exposure estimates for ambient PM2.5 at a global scale at a fairly high resolution, and that also included exposure estimates for a 24-hour ozone. So this data is necessary to tell us how much air pollution are people actually breathing. And we've never had this information at this scale before. Under that same assessment, there are really important advances in what we refer to as the integrated response functions. That is the model of how much air pollution leads to a certain quantity of health impacts. And we're able to utilize those for really high amounts of air pollution, whereas before we couldn't really capture those impacts at high levels of air pollution. And furthermore, the IPCC process in its annual its regular assessment, I should say, that occurs every 5 years, produced what are commonly called the representative concentration pathways, which is an attempt to capture how it is that sector-specific emissions and climate impacts are changing over time, beginning in the year 2000 and looking outwards. And actually, there was work that looked at even further back to 1765, and that looked much further. And so this gave us really an unprecedented access to a high degree and high quality emissions data that we could use to look specifically at the transportation sector. And finally, there are a number of these really powerful tools that have been needed to inform the IPCC process, but also to inform other work as well, including the work of HTAP and the long-range transboundary air pollution work, looking at how it is that air pollution is moving across the world. And that includes tools such as the Mozart 4 model, the GeoSchem model, TM5, the GIST model E, which is really a climate model but has the capability to capture aerosols as well. And so with these opportunities come some still not insignificant challenges. And that includes how it is that we actually model how much of the transportation pollution people are breathing. We can't just, it's rather challenging at a global scale to say how much of the air pollution any one individual or any one city is breathing that is coming directly from the transportation sector. So we have to come up with ways to figure that out. Furthermore, in the most recent global burden of disease assessment, there is a quite clear agreement that there is what's called a nonlinear dose response, which means that we can't simply say that the amount of pollution someone's breathing from transportation has, or that the, say a 1% increase in the amount of transportation emissions that they're breathing equals a 1% increase in their health impact. In fact, what seems to matter is how polluted your air already is, and that determines how big your health benefit will be in response to changes in transportation-specific emissions. So that's sort of a funny and a really interesting result of the global burden of disease work, which has led to some quite challenging and often even philosophical discussions we've had about how we judge the benefit of transportation emissions control. But it's relevant to the other sectors as well, so it's not something that only we are looking at. And finally, there's some work on emissions modeling that we think is important and that still needs to be done, including further updates and evaluation of global sector-specific emissions, including emissions for more recent years. So this is my last slide, and then I'll hand it over to Sarah, but I just wanted to give folks a sense of how it is we've been tackling some of these things. Beginning in 2009 at the ICT, we held a strategy session around how we're handling and dealing with our air quality work. And that led to we conceived at that point a long-term project to assess the global health impacts of transportation. The following year, we had discussions with a number of modelers who might be able to utilize some of the recent work from the representative concentration pathways. And this led to serious discussions with very high quality research team at UNC Chapel Hill using the Mozart model, and it led to a collaboration. We, in parallel with this, had already undertaken our own work at the ICT to model future health impacts using a much more simplified emissions model and health impacts model we refer to as the health roadmap, and that's available on our website for those of you interested in how the ICT sees the future health impacts changing. So that's in contrast to our global snapshot, which is really focusing just on what the historical burden has been and looking at that historical burden in a much more precise and rigorous way. And finally, the most recent event in October was our publication with UNC Chapel Hill of a paper in the journal Environmental Research Letters of what our findings are for the year 2005, giving our preliminary estimates based on this high resolution emissions data that Sarah will talk about, coupled with high resolution air quality modeling, and the really valuable work that was done with the global burden of disease. So I'm going to stop there, and I'm going to just pause so that I can hand this over to my colleague Sarah Chambliss. And so Sarah, as the lead author on our ERL paper, is going to walk folks through really the challenges and the findings that came out of our ERL paper, but really to provide a little bit more detail and context for those of you that are interested.
All right. Well, thank you very much, Ray, for that introduction. In this first section, I'm going to be talking about our recent findings. I'm only going to briefly discuss our methods and the results that we produced. So if you want more detail, please ask questions in the chat over in your GoToWebinar control panel. Or I invite you to look at the paper itself after the webinar is over if you haven't already. It's published as open access, so there's no cost. You can share it with people if you want, and we will provide a link to access that paper in the final slide. So at the inception of the Snapshot project, there were very few estimates of the global health burden from ambient PM 2.5 as a whole, and I don't believe there are any estimates of the health burden that were source specific to transport or specific to coal-fired power plants. So it's only been recently that this work has really been explored. In 2011, Drew Schindel and colleagues estimated the health benefits from transportation policy. So they looked at the change in health impacts that would result from increased control of vehicle emissions And they presented the results mostly at a regional level rather than a national level. Very recently, several groups have published studies that are addressing exactly this topic. In the US, 2 studies came out last year that were sector-specific and highly resolved. Fan et al. Is shown in this top graphic, and then Kayazo et al. In this lower graphic. Both of them only covered the US. So most countries do not have this level of information, this level of analysis that's considered how different sources contribute to the overall burden of air pollution health impacts. Our report in 2013 that Ray mentioned covered the whole world, but only urban areas, and it didn't cover secondary pollution, secondary PM 2.5 that's generated from precursor emissions. And then finally, most recently, the Global Road Safety Facility and the Institute for Health Metrics and Evaluation put together a report that used lower resolution source receptor modeling to identify the contribution to ambient air pollution, ambient PM 2.5 that came specifically from vehicles. But it wasn't at a national scale, it was regional scale. So in brief, the need from policymakers is for global coverage and for national scale, or if possible, city scale results, because that's the level that policy is made. And these results need to be up to date. They need to reflect the current state of emission control, the current state of emissions. And so our recently published work is sort of the first step in this direction. Again, this is the publication on environmental research letters. We'll be providing the link, and I encourage anybody who's interested to download it. So to produce these estimates, we synthesized data created by several groups. One of these groups was the Outdoor Air Pollution Expert Working Group for the Global Burden of Disease Project, and in the graphic, those pieces are represented in blue. And the other group are collaborators at UNC Chapel Hill, Jason West and Raquel De Silva. They produced high-resolution atmospheric chemistry modeling. So this modeling was used to create what we called the transportation attributable fraction, or we're referring to it as TAF from here on. TAF is a value that ranges from 0 to 1 that expresses how much of ambient PM 2.5 comes from transportation emissions. So the model that we ran was the model for ozone and related tracers, the 4th generation of this, Mozart 4. And it was run using the RCP 8.5 representative concentration pathway emissions. And it was run at a resolution of 0.5 by 0.67 degrees, which is a high resolution for a global scale model. The TAF was calculated for each grid cell at a 0.5 by 0.67 horizontal resolution. And then we processed it to create population-weighted national averages. It was these national averages that we then combined with global burden of disease data. And so the approach that we took here, which is estimating TAF and keeping it pretty separate from the health impacts for pretty long in the calculation, there are several reasons for this choice. For one, it provides transparency for those comparing these estimates with other health impact estimates. So in recent studies, there are estimates that can vary quite a bit across from study to study, and it can be difficult to know what these differences are coming from. Are they attributable to different source apportionment methods? Are they attributable to different health parameters? So as an outsider looking at these studies, it can be difficult to know why the differences occur, which numbers you really want to trust. Do you want to take an average of the two? Do you only want to use one because it didn't fit your model for calculating this? So we wanted to keep the standardized health methods that the global burden of disease produced, and then just add in the transport sector as the sort of second layer on top of that. And then additionally, repeating work is good. It's good to have independent sources come together and produce estimates of the same thing in a different way. But at the scale that of data collection and analysis that the global burden of disease requires, it really didn't make sense for an institution like the ICCT to try to replicate all of their work. It just made sense to build on top of the work that had already been done. So I wanted to highlight briefly two of the major improvements in health estimates that were made by the global burden of disease team and that we took advantage of in this study. So the first was the use of satellite data along with modeled air pollution data and ground-based measurements to produce the overall sort of synthesized exposure estimates for the health analysis. So this is more accurate, I believe, than pure modeling because you can use satellite data to correct modeled data, you can use ground-based data to calibrate all of that. And I don't know how many of you have worked with models, but you can often find that for point by point, the ambient concentration that's predicted by a model will vary quite a bit from the measured concentration. So this is an improvement that needs to be made. And it's work that's carrying on. I believe that Michael Brower and the team have produced new exposure estimates for 2012 and are going to be continuing this work. The second innovative piece of the global burden of disease study was the integrated exposure response function, which analyzed and combined a fairly comprehensive body of epidemiological evidence that include both, it included exposure to ambient PM2.5, but also exposure to secondhand smoke and other epidemiological studies that allowed them to create a function that extended beyond the observed exposure to PM2.5 in the United States, Canada, Europe, where many of these epidemiological studies had been done, and really capture the level of exposure that was happening in very highly polluted megacities. And as Ray mentioned, there is a nonlinear relationship between the level of exposure and the increase in risk. So by using the baseline exposure rate, this real-world exposure estimates that were created by Brower et al., and by using the TAF, we're able to get around this problem of the change in marginal risk increase depending on what the assumed exposure level is. So as this illustration below shows, we took the real-world baseline and real world is, it's still a model, but we're considering it to be the real baseline. And then we can linearize the change from the counterfactual up to this real world, and then take the TAF to generate a sort of equal, a change in risk that's equal to the contribution to air pollution. Because we want to treat each source of pollution as contributing the same proportion to the total health burden as it does to the ambient pollution level, rather than assuming, oh well, transportation will be reduced first or last, and that will change the effectiveness of reducing that pollution. That's sort of a, I mean, perhaps if you're looking at it from a very academic perspective, you want to do it that way, but I think that in general, we think of all sources as being sort of equivalently effective when you reduce them. I mean, it's not a perfect way of looking at it, but it does avoid some of the odd consequences of the nonlinear function. So moving forward to the results of our TAF modeling. Again, this was produced using Mozart 4 and RCP 8.5 emissions. And TAF was estimated using the zero out method. So first, the model was run with all sources. And then it was run with all sources but transportation. And then the difference between the two model runs gives the contribution of transportation to overall PM2.5. To my knowledge, this can be done with any chemical transport model, but some models have more complicated tracer algorithms, which have been developed fairly recently, and they were used by Fan and his colleagues in the United States specific source apportionment or source impact study, which is pretty interesting, but we did it in the zero out method. The source that we zeroed out was surface transportation. So this includes on-road and off-road vehicles, but it doesn't include marine or aviation. And that's somewhat reflected in the results here. You see there's nothing over the oceans. There's no big flight paths or ship paths. And finally, this was done for the year 2005. I don't know if I had mentioned that before. The results were that from region to region, the TAF ranged from less than 1% to about 24%. We see peaks in Europe, in the US, and Japan, which are all typically areas with high vehicle activity, but there are also some other locations where there are peaks, like Mexico City. You see some of the coastal areas in South America, some places in Southeast Asia. And I wanted to remind those of you who are looking at perhaps the low TAF in China and in India, that these are relative values. So although they have a low TAF, if you were to consider the absolute concentration attributable to surface transport in terms of micrograms per meter cubed, those values are more comparable to, say, the United States. They're still lower, but they're more comparable. And this data is given in further detail in the paper. One more note on that subject is that the resolution of the data here, 0.5 degrees by 0.67, it encompasses a large enough area that it's not sensitive to urban hotspots or near road exposure. So the TAF we estimate for any given point is the TAF for the whole area of the grid cell. And so you're not going to see these very high TAF values that you would expect in a very high traffic density urban area where there's other industry or burning or other things around. They're fairly averaged values geographically. All right, so moving on to the results. The global total here that we produced was about 250,000 early deaths from transportation emissions in the year 2005. This total is comparable to the global road safety facility estimates that I mentioned earlier, which were 184,000 from on-road transportation. Echoing one of the main points that Ray mentioned earlier, we found that making these estimates is possible, but they're also limited. So here we have national level results, and for many countries, this is the first estimate of the transportation-specific health burden from ambient PM2.5. On the other hand, the confidence intervals are fairly large, and so the estimates aren't precise. We wouldn't be confident in a strict ranking of countries or political groupings, but it indicates the general state of things in 2005. Because a lot of this, more or less the entire calculation exercise was modeling, we wanted to make an effort to compare and test these values against measured data. But this is difficult for source-specific pollution because one can't directly measure the concentration of pollution attributable to a specific source. the best comparison that we found was against receptor-based estimates of, the fraction of collected PM that can be traced back to mobile sources. So I'm not going to get into the chemical mass balance calculations and how receptor-based measurements work, but the most important thing is that they're produced in a way that's more or less independent of the assumptions that we made in our modeling. They don't require an emissions inventory or chemical transport modeling. Sometimes they'll take into account wind direction, but that's about it. We conducted a literature search and found 50 data points within 3 years of our modeled year. We had to expand out the time range because there aren't that many studies that look at this, and 50 points for a global study isn't a great number to calibrate our model against. And although in theory this is a very valuable comparison because receptor-based estimates are free from most of the assumptions that go into the modeled estimates, in practice for this specific comparison we weren't really able to draw many conclusions. The correlation was poor, which isn't encouraging, but at the same time this is because there's pretty high uncertainty in the receptor-based estimates as well as in the modeled estimates. So this is an area for improvement, and this leads into the next section where I'll briefly discuss some of the research necessary to take this work forward and to improve on the work that we've done so far. There are many opportunities to extend and improve this work. Some categories of improvement are in the uncertainty. We're aware that there's a high level of uncertainty, and much of this isn't quantified in the work that we've done. And we hope that improving and validating modeling can narrow the confidence intervals, provide more of a sense that you know exactly who is experiencing the highest health impacts from transportation. Additionally, we expect the PAF to change dramatically over time. This was a study that we did in the year 2005, but the policy landscape has changed completely since then in most major markets. Euro 6 has come online in Europe, and in the US, new heavy-duty, the 2007, 2010 heavy-duty controls, and now Tier 3. All of these are going to dramatically change the pollution rates from vehicles, over time as new vehicles come on the road. And in China and in India, there have also been new emission control policies put in place. So some of the most useful applications of this data require tracking changes over time and looking at how effective policies have been. And our vision is for this work to continue to be updated and to continue to be improved, if not by us, then by other researchers in the field. And really, we're going to rely heavily on work by other researchers if the ICCT is going to continue this work. So in the next section, I'm going to describe some of the work in multiple fields that would support such improvements in this endeavor. Estimating the source-specific health burden, either specific to transportation sources or specific to any other sources, requires a long chain of modeling steps. So it starts with emission factors and activity or energy consumption that those emission factors are applied to. And it moves through converting the emissions to model-ready emissions inputs that are spatially distributed and chemically speciated. And then it continues through the process of chemical transport modeling, and then finally the modeling of the health impact resulting from the concentrations. As I mentioned before, we only included uncertainty in the health dimensions here, the exposure modeling, the concentration response function, and the counterfactual. Quantifying the uncertainty in all the rest of this modeling chain is the first need for the sake of comparability. There are more efforts coming out to quantify the health burden of ambient PM 2.5 from specific sources because it is such a policy relevant question. You control things by source, so you should know the impacts by source. But comparing one study's estimate with another, they're going to be quite different, and unless you know the range of uncertainty, you can't really know whether there's a problem with one model or another. You know, maybe they're essentially the same estimate, just different ends. Maybe one really has a big gap. Quantifying uncertainty is the first step, but the goal is to eventually improve the underlying data, improve the underlying methods used to produce these estimates. And so in the best cases, we'd be continuing to evaluate how well models are working and return to the models, correct them, and the process continues until we have really our very high confidence in the answers. So for the research agenda, the first step here is at the foundational emissions data level. We need timely updates to sector-specific emission inventories in order to provide up-to-date estimates of the health impacts. Preferably, we want these emissions at a high resolution, but keeping them timely and high resolution is a trade-off because it requires a lot of work to put these together. With more collaboration and sharing across research groups, limited resources can go further to help this effort along. But I think that there needs to be a strong emphasis put on committing to and following through with dependable emissions inventories that are going to be the basis for the work of modelers, those who are looking at policy. It's really a foundational bit of data. The next point on our research agenda is to create more robust source apportionment estimates by combining modeled and measured data. So measured data could just be the PM2.5 concentrations annual average that is collected from ground monitoring stations. This is really important in validating and correcting modeled exposure. But it also includes speciated PM2.5 and the receptor-based source apportionment that's generated from those measurements. We took a first step in this direction when we tried to compare our values against some receptor-based points, but there is currently a lack of consistent methodology for, well, there is some consistent methodology for creating source apportionment estimates, but there are many studies that don't necessarily follow this methodology, and so there needs to be improvement. I think a consistent set of data where you can know that the methodology was followed sort of similarly for all points collected, and you can make conclusions about where the uncertainty may lie for that, really helps in taking the data from the modeling direction and the data from the measuring direction and letting the two of them really inform each other. And there has been some good work in this arena. Very recently, just this year, there's a publication out of the Georgia Institute of Technology where the initial source-based approach, starting with emissions and then modeling source-specific contribution to PM2.5, was refined by comparing against receptor-based measurements. And this is a really fruitful and important field to explore. So far, this study only has done this for 6 cities. For global level calibration, we require orders of magnitude more, which is somewhat daunting. But it's also daunting to think 10 years ago that we would need ground-based PM2.5 measurements around the world. And the community has really come together to provide that. So it's possible. But building up a consistent methodology for estimating source apportionment, continuing meta-analyses so that this data is brought together consistently and compared, and really collaboration across different disciplines, collaboration between modelers and measurement labs can leverage the existing work that's being done to produce estimates with more confidence from both arenas. Finally, on the research agenda is to design global models with high-resolution urban exposure in mind. We want, there's been some really great innovative work done in creating chemical transport models. We've already seen work on variably nested modeling that can provide higher resolution in high population density areas. So it can balance the computational demands of high resolution modeling against the, well, I mean, you don't really need to know very high resolution concentrations across the Sahara Desert as much as you would need in a highly densely populated area if what you're concerned with is exposure. So there's been some great work in improving models in that area, and it's important to just see this work continue to evolve and to be taken up by the modeling community. And there's also been some good work in looking at the differences between models in predicting aerosol concentrations with the atmospheric chemistry and climate model into comparison project. And that's just more work that needs to continue to better understand the weaknesses, the gaps in our knowledge about exposure and about PM 2.5 modeling, and moving forward, improving on that. So really, to summarize, updating this work requires more data, and that data is not easy to produce. Running the high-resolution chemical transport model that we ran took, I think, 2 weeks per run, and that's not including the time that it takes to do error checking and debugging, and that adds up. And creating and updating a global emissions inventory is also an incredibly immense effort. The current emissions that we're using were based on a year 2000 inventory. There's work underway to create a 2010 emissions inventory. Oh, I'm sorry. Oh, I'm sorry. I wasn't moving the slides along. This was the work that the Georgia Institute of Technology did in creating the hybrid approach to source apportionment. And then this is the summary slide. So anyway, there's work still underway to be creating the emissions inventory that will capture more up-to-date data the year 2010. But it's already almost 2015 and the policies change. So I think that really there needs to be continued support and continued attention paid to this need. And then finally, the health data, including the baseline incidence of the relevant diseases, is also a challenge to collect. The coordination and continuing work by the Institute of Health Metrics and Evaluation does enable regular updates. And just creating this institution that is responsible for producing these regular reports, dependable data, and sharing this data, making it available. Although a lot of the work is done by collaborators, who aren't necessarily affiliated with the institution, just having it exist as a group that owns this issue and is responsible for carrying it forward, I think is really critical in making that a dependable source of regularly updated information. In general, the story all sort of ends with the fact that collaboration and cooperation are essential. No one group can do this on their own. No 5 groups can do this on their own. It's really going to be a matter of better information sharing, awareness of what's happening in other disciplines, and creativity in bringing existing research together in order to create this very policy relevant information. To recapitulate what Ray mentioned at the very beginning, there are not very many estimates that currently exist of the global health burden of transportation or of other sources. The ICCT, in putting together this first snapshot publication, has demonstrated that these estimates are possible and that the data is out there to put them together, but the data is currently limited in the amount of precision and confidence that lies in these estimates. And I've outlined this research agenda to carry forward the work, which brings together the work by emissions modelers, by air quality modelers, by those who are collecting measurements on the ground and performing source apportionment on these measured data. All of this is necessary to create better estimates and more up-to-date estimates of the damage that's done by pollution and the possible reduction in that damage that can be achieved by controlling it. So this interdisciplinary synthesizing of all of this information can go very far in informing policy and can better support the efforts of health experts worldwide to address this problem of air pollution and to protect public health, improve public health. All right, so if you have any questions for me or for Ray, please enter it into the chat window. These are our email addresses if something occurs to you later. If you're interested in the Clean Air program at the ICCT, this is the website, and then this is the download link for our publication. And I will open the floor up to any questions that we've received.
All right, thanks, Sarah. I think I'll try to moderate some of this question and answer here. Again, for those of you who'd like to read the publication, there's the link right there. If you have any questions that you think require a lot more follow-up, we're happy to take those via email. You can also find my contact information or Sarah's contact information on our website. And I just thought that what I could do here is maybe take up just the question of what is the ICT doing next on this topic. And also there's one question I wanted to throw to you, Sarah, around how we might use tracer modeling in the future. But just to first take up this question of what the ICT is doing, and we already have this capability in-house to estimate health impacts from primary emissions in urban areas. And so we've been applying this in China through a study that is supported by the Climate and Clean Air Coalition, which looks at the costs and benefits of a shift to China 6 vehicle emission standards. That study is still in the works, but we expect will be completed early next year. We have already done a retrospective study for China where we looked at what the retrospective health benefits have been of China's vehicle emission controls and what they could be in the future with the shift to cleaner engine standards. We've done similar work for India. We have published on our website a roadmap for India looking at baseline health impacts and possible avoided health impacts of cleaner emission standards. And those two pieces of work reflect the kind of health modeling capabilities we have here at the ICT. And there's also been a study that was supported by the World Bank that we published, or that I should say was released last year, that looked at the costs and benefits of diesel black carbon emission controls in a handful of developing country cities. And that included cities like Istanbul, Sao Paulo, Jakarta, Indonesia. And that work produced an in-house city-specific emissions and health impacts model that also was coupled to cost-benefit analysis. And just yesterday here at the ICT, we had a presentation on an entirely new cost-benefit module that we'll be able to link up with our existing emission models here that will be designed specifically to look at policy levers and scenarios so that we can use that information to better inform the work of our partners in country. I'll mention as well some ongoing work that is being coordinated with the WHO and the Global Burden of Disease, and the team there, and we'll call out a few names specifically: Michael Brower at the University of British Columbia, Aaron Cohen at the Health Effects Institute, and others. There's sort of a common group here that has had a long-standing collaboration and has published a lot of important work in this area. But they're starting to look at source-specific health impacts really for the first time, and that'll begin with looking at the coal sector. My understanding is that they'll be looking at specific regions in Asia, in Europe, and then they'll move on to the transportation sector. And so that'll be really important work we'll certainly be looking out for. But the ICT will continue to both support that effort and also encourage the research community as a whole to move along this path. And so I just wanted to make sure people are aware of the kind of work that is ongoing. And so I wanted to maybe just stop there and maybe throw one question to you, Sarah, and then we can perhaps call the webinar to an end. Perhaps if you could talk a little bit about the tracer method and how that might give us better modeled estimates of vehicle-specific emissions exposure.
Sure. Well, I don't claim to be an expert about different chemical transport model algorithms, but I know that there have been in CAMEX and CMAC these algorithms that have been implemented to use sort of dummy pollutants that are stand-ins for precursor emissions, and then trace where these end up and use them to allocate the portion of secondary pollution that's from these specific sources. So this can be used either to find where pollution ends up from a particular geographic source, because city, or from a specific emissions sector. So I'd say it's a very interesting and probably it improves upon the zero out method in a number of ways. But at the same time, it's only one link in the large chain of modeling that needs to be done in order to produce source-specific health estimates. So if you really refine and polish the way of estimating a source-specific, the transportation attributable fraction or a source attributable fraction, but you're still using fairly crude emissions, or the health impact portion is done in a much more rough way, then it doesn't necessarily improve the quality of the outputs. So yeah, I think that it is a great thing to continue to use different approaches to model the source attributable fraction and source attributable PM, and then to continue to compare that against different methods to understand how much they vary. But yeah, I wouldn't say that that is the be-all and end-all of improving this methodology.
Okay, great. Thank you for that, and thanks to all of you for participating in today's webinar. It's been a great pleasure for us to really dig into these topics, and as you can see, we've learned quite a bit and feel like we have a lot of lessons to share. And so for those interested in this topic further, please feel free to reach out to us. And for those interested in possible further collaboration in this area, we're open to any dialogue on that front. So thanks all again, and we hope that you all have a great day.